President Trump has tried to downplay the spread of coronavirus and boost public perception around the government's national response.
We're prepared and we're doing a great job with it, and it will go away.
But weeks of delays, error-ridden testing kits, and bureaucratic hurdles are just a few of the mistakes that make up an entirely different picture, one in which the number of tests available in the United States is nowhere near the national demand. His Vice President, Mike Pence, even said so.
We don't have enough tests today to meet what we anticipate will be the demand going forward.
So let's take a look. In February, the World Health Organization shipped kits to dozens of countries.
We have shipped supplies of personal protective equipment to 21 countries and will ship to another 106 countries in the coming weeks.
But the United States went about creating its own tests. That's according to ProPublica. That created delays and confusion from the outset. And Senator Patty Murray, the ranking Democrat on the Senate Health Committee, wrote a letter on March 5th demanding an explanation for why the COVID-19 test approved by the World Health Organization was not used in the United States. We haven't heard yet a response. When the CDC did send tests to labs across the country in February, some of those initial testing kits were faulty, drastically limiting the United States' ability to respond and diagnose the virus properly. The criteria for who was eligible for the COVID-19 testing was also particularly narrow, considering the shortage of tests. Those flawed test kits are now being investigated by the Department of Health and Human Services. When labs tried to develop their own tests, they came up against a bureaucratic requirement that forces these labs to seek FDA, quote, emergency use approvals. That takes time and, again, drastically curtailed the U.S.'s response. That was evident for doctors at the University of California, Davis, where a woman was hospitalized for days before finally being tested for COVID-19 on February 23rd. She hadn't initially been tested because she didn't fit the CDC's criteria for COVID-19. The woman's test came back positive. While South Korea has tested more than 200,000, officials in the United States have also publicly announced that they really don't know how many people have actually been tested.
How many Americans have been tested at this point?
We don't know exactly how many because hundreds of thousands of our tests have gone out to private labs and hospitals that currently do not report into CDC.
And of course, here's the problem. Without testing, not only are people walking around and possibly sharing the virus, but scientists aren't able to track the hotspots and focus their resources. The CDC now says that anyone who wants to be tested for coronavirus can get one if a doctor signs off. It relaxed eligibility requirements on March 4th, widening the pool of people who can be tested if they exhibit symptoms. But getting tested had been and continues to be an issue. A nurse in California released a statement through the California Nurses Association saying she had been caring for a coronavirus positive patient. She wore protective gear, but then started to feel sick. A few days later, her public county official agreed to a test, but the CDC didn't.
They said they would not test me because if I were wearing the recommended protective equipment, then I wouldn't have the coronavirus.
In another instance, a journalist for the New York Times said she had to go back 3 times before getting a test. Other mistakes were made, like the CDC releasing a Texas woman from quarantine just before she tested positive. While state officials begged the CDC for more testing, outside of the government, some progress is being made. Employees of the University of Washington's medical system have set up a drive-through testing center in the hospital's parking lot. And a program funded by the Bill and Melinda Gates Foundation may soon be offering at-home testing kits. As the government fails to meet the demand on these tests, charities are stepping in, and the virus continues to spread. Now, the number of tests is increasing. Health and Human Services Secretary Alex Azar said 1.1 million coronavirus tests were shipped to labs and hospitals around the country, and millions more will be ready by the end of the week.
Where are we with this? Because there are other countries, like Australia, where they apparently have no shortage of tests.
You should answer that.
Yeah, so listen, I just tried to get a patient tested an hour ago, and I couldn't in my outpatient office.
In your opinion, that person should have been tested?
I would have liked to test her.
The test typically includes a swab down your nostril and throat. As for cost, private health insurers have agreed to cover treatment and waive copays for coronavirus-related testing. And it's important to note, while some coronavirus-related fees may be waived, not all. And the tens of millions of Americans without health insurance would still need to cover all the costs.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.